The liver is the largest gland in our body and is found in the upper and right side of the abdomen, below the diaphragm and near the transverse colon and stomach. It is red-brown in color and weighs about 1.5 kilos. The liver performs numerous functions, more than 500, which are essential for the correct functioning of the whole organism. It produces bile, synthesizes plasma proteins, intervenes in the metabolism of carbohydrates, proteins and fats, and removes harmful and toxic substances present in the blood. However, when the liver does not work properly, it sends us some signals, which are not always easy to interpret and can often be confused with other pathologies. Let's see some of them. Dark urine. Urine is nothing more than the final product of kidney excretion, through which the metabolic products present in the blood are eliminated from the body. Typically, a healthy person's urine is pale yellow in color and clear in appearance. However, if they have a very dark appearance, they may indicate impaired liver function, but also pathologies related to the urinary tract. The dark color is due to the deposit of some organic substances, such as bile and hemoglobin. Often the cause can also be the intake of certain drugs or in case of severe dehydration. Yellow skin color. One of the functions of the liver is to dispose of aged or damaged red blood cells, which are destroyed by the spleen. Their breakdown forms bilirubin, a yellow-orange waste metabolite. However, when the liver does not work properly, the levels of bilirubin in the blood increase, causing a yellowing of the skin, mucous membranes and ocular sclerae, that is the white part of the eyes. We talk about jaundice and can be a warning sign of a liver malfunction. Hepatic steatosis or fatty liver. Hepatic steatosis, also called fatty liver, indicates a clinical condition caused by an excessive accumulation of triglycerides in liver cells. The presence of the right concentration of fat is completely physiological, but if it exceeds the threshold of 5% to 10% of the weight of the liver, we speak of hepatic steatosis. In most cases, no particular symptoms are felt. In some cases, however, you may feel excessive tiredness and a slight abdominal discomfort. If left untreated, fatty liver disease can evolve into steatohepatitis, an inflammation of the fatty liver, and then into liver cirrhosis. Halitosis. It is a very common disorder that causes bad odor to emanate from the mouth, and in some cases even from the nose. However, when bad breath becomes constant over time, one of the possible causes is cirrhosis of the liver, a chronic and degenerative liver disease characterized by the formation of fibrous scars that are capable of irreversibly damaging the organ. Hepatomegaly. Pain localized in the upper right abdominal region, which can worsen in case of palpation, nausea, loss of appetite, and digestive difficulties can suggest hepatomegaly, that is, an enlarged liver, which increases in volume outside the clinical standards. There can be several causes: metabolic, infectious, or neoplastic diseases, but also side effects of certain drugs. The liver is an extraordinary but at the same time very vulnerable organ. Alcohol, smoking, drugs, viral infections, and a diet rich in saturated fat can cause chronic inflammation of the liver and damage it irreversibly, thus reducing organ function. However, the liver has a unique ability, namely that of regenerating itself, and it does so thanks to some hepatocytes present in specific areas of the organ, which are responsible for producing new cells in case of tissue damage.